Okay, now I've officially finished my shameless plugs for the College of Pharmacy. So let's get to the real reason why we're here today. So uh, at the top of the segment, we sort of alluded to mental health awareness, right? But Kayla, tell us a little bit about the student organization that you're a part of, your roles within the organization, and what sort of things we have planned for this semester.
Yeah, so I am currently a member and officer in the HCOP student chapter of AAPP, which stands for the American Association of Psychiatric Pharmacists. This is a national pharmacy organization focused on psychiatric pharmacy and mental health medication that aims to ensure people living with these mental illnesses receive safe, appropriate, and effective treatment. So, as a student chapter, we try to advance AAPP's vision by organizing mental health awareness events focused on starting the important conversations about mental health in college campuses and keeping these conversations going. So, we currently have chapters both on the Auburn and Mobile campus, and I am the mental health outreach chair for Mobile. So, my main job as outreach chair is to just organize the annual mental health fair in the South Student Center. So, I joined this organization because mental health and spreading awareness for mental health is something I'm very passionate about. The mental health fair is a way for me and other students with the same passion
Mhm.
to offer mental health services like anxiety and depression screenings, as well as blood pressure and blood sugar screenings as well to the students at South. This year, we are actually taking part in a national campaign called Script Your Future, where their main purpose is to raise awareness on the importance of medication adherence. So this year, AAPP is collaborating with the Script Your Future initiative to focus on mental health awareness and also mental health medication adherence among college students. So, at the mental health fair, we will also have the opportunity to counsel students on the importance of staying adherent to mental health medications as one of several activities we have planned. So, for those interested, the mental health fair will be on March 17th, which is a Monday, from 11:30 a.m. to 4:30 p.m. in the Student Center Terrace.
Yeah, absolutely. So we're really excited about this event happening in the middle of March. So when it comes to issues like mental health, right? College students certainly not immune to having to deal with these the challenges that these conditions present. But Kayla, how common are mental health disorders among this population of college students?
Yeah, I'm sure I'm not the first to say that college can be a very stressful time for many of us. It's actually research proven that many college students experience their first onset of mental health problems as well as substance use problems, unfortunately, during these years. And to give some numbers for those statistics people out there, anxiety disorders are the most prevalent psychiatric problems among college students, with nearly 12% of college students suffering from an anxiety disorder. These anxiety disorders can be anything from social phobia, panic disorders, generalized anxiety disorder, and even PTSD. Um, Another common mental health problem among students is depression, with prevalence rates in college students being between 7 to 9%. So, suicide, although not a specific diagnosis, is the third leading cause of death among young adults. And as you can imagine, this is a very significant problem
Mhm.
among students. There was actually a survey study done that reported among around 8,100 students that 546 of these students reported suicidal ideation. 130 of these students reported having a suicide plan, and then 41 of these students reported making a suicide attempt in the past year. So you can see how crucial it is to have this conversation with young adults, especially college students. And I think we as a society have been doing a good job starting that conversation on mental health, but now we need to keep that conversation going and educate people that it's okay to ask for help and to seek treatment for your mental health diagnosis.
Yeah, I think that's really helpful insight. I think when I hear those numbers, I hear think 12%, 9%. That's 1 in 10. So you think about these students who have these friend groups, and just looking around their friend groups, 1 in 10 of people in these friend groups struggle with one of these mental health disorders. And as you mentioned, I think the numbers, I think it really does showcase to me, how important it is to, as you mentioned, keep that conversation going. And for others with mental health challenges to know that they aren't alone, right? That there are many others who are, in their circles around the university that have similar shared experiences in the context of mental health, and that it's okay to talk about it. It's okay to acknowledge it. It's okay to ask for help. So, Kayla, I know when you and I were sort of preparing this segment and sort of talking about, what things we needed to cover, you discussed part of your journey, right, with anxiety with me. And so I was hoping you might be willing and open to sort of share some about what it was like to kind of walk that path and sort of how it has formed and sort of molded you. So when did you first realize that you were experiencing symptoms of anxiety, and sort of how did you know?
I realized at a pretty young age, I would say around middle school or even a little bit before. Um, but at the time, I didn't know what it was or if it even had a name. I just would feel all the symptoms of anxiety, and it may look different for everyone, but for me, it was restlessness and not being able to sleep at night, stomach pains, feeling nauseous, and uncontrollable shaking. So, yeah, these are very scary to experience as a kid. And in severe cases, I would even get attacks. So that was also very terrifying.
Yeah, I can imagine how impressionable that could be, certainly as a young adult. So, how has living with anxiety sort of affected your daily life, both inside and outside of the classroom?
So I think I've always done well academically. I'm one of those people that also have performance anxiety or
Hmm.
test anxiety. So that has gotten the best of me a couple times. But other than that, academics hasn't really been an issue. It's more in my personal life. Um, because I've had it for such a long time, I know how to deal with it now. But there were times when I experienced a severe anxiety attack, and I had to go to the hospital or the ER. That's obviously scary, but it has gotten better, and I haven't had to go to the hospital for a while now. So the counseling that I've been to, the therapy, and the medications that I'm on has definitely helped.
Yeah, that's great.
Mhm.
Um, I think one of the other pieces of dealing with anxiety, but really anything. And I mean, we're talking about you specifically with your path with anxiety, but that certainly this applies to many other, um, mental disorders that are out there. But they do face a lot of undue stigma, right? Stigma that certainly doesn't deserve,
Mhm.
right? But nonetheless, it's there. So, have you faced any of that? Have you faced any of the stigma or misconceptions out in the public about having anxiety, and sort of how have you coped with those and dealt with those?
Plenty of times. Yes, I've been told to just relax or to stop being dramatic and that it's all in my head. And, that's never great to hear when you are experiencing these very physical symptoms that I
Mm-hmm.
mentioned earlier. But I try not to let those type of comments affect me or think differently. I come from a culture and a family that doesn't really talk about mental health and kind of just brush it under the rug. So growing up, I didn't really know who to go to or who to talk to. And I think that's another reason why I feel so passionately about this topic and this initiative and yeah, why I'm a part of it.
So I guess reflecting on your experiences and how you've encountered these stigmas and misconceptions, what do you think are sort of the biggest misconceptions about mental health disorders that college students might have?
Yeah, I think the biggest misconception is that it's only temporary,
Hmm.
which might be the case for some people, but it's not for others, or that it's not real, or that maybe they think they're weak and they need to toughen up, but this isn't the case. And like I said earlier, it's okay to ask for help.
Yeah, absolutely. So you mentioned seeking for help. So now, how did you do that? Did you seek help? Sort of what helped you to take that step to say something's not right? I need something more.
Mhm. Yes, so I actually used counseling services that were available to me at Auburn. I went to Auburn for undergrad.
Okay.
So I went to counseling for a while and tried to do non farm things. Now, non farm things just basically mean um, stress reduction and self care practices, anything that is not taking a medication. And while these worked for a while, I knew I needed to be medicated for my anxiety. So I went to my primary care provider and she was able to help me and prescribe me medication for when I do experience an attack.
Awesome. So, I know you mentioned you just went to or you utilize your primary care provider to sort of help you navigate that path to getting your anxiety um, under control. So, I guess what has your experience been like, sort of navigating these
Mhm.
different techniques and non-farm, as you mentioned, or,
Mhm.
or medication?
Yeah, my experience so far has been pretty good. Through the professional help that I received, I was able to control and treat my anxiety, and why I feel so comfortable talking about it today
Mhm.
here on the radio. Since I'm in pharmacy school, I knew even before seeing my primary care provider what kind of medication I thought she was going to put me on. So I loved having that knowledge and advantage, and I know it makes their job much easier.
So, sort of closing out this part of the segment, sort of what would be some advice that you would give to other students who might be in your similar shoes, or dealing with struggles that are sort of in this same sort of domain? What advice would you give them?
My main advice would be that it is more than okay. In fact, it's encouraged to seek help. Go to therapy, go see your doctor, go see your pharmacist, even, and they can help you lead to um, resources that you probably weren't aware of before, and it will never hurt to try.
Absolutely. Well, thank you, Kayla, for being willing to share that. I know that it's not always easy in the context to come in a public forum and talk about something that in some cases is uncomfortable, that caused you or that can cause duress in some scenarios. So really, I really do appreciate it. It does seem like there can be great freedom that can be gained just by acknowledging that something's not normal, or you need help, and going and ask for it. So again, thank you again for your openness and sort of sharing your experience, as we can work to, as you mentioned, continue to keep these important conversations going about mental health.